Today's topic, Clostridium difficile, or C. diff. Joining me to talk about this very serious bacterial infection is Erin Archer Kelser. She is a registered nurse, an infection preventionist, and a freelance writer, and she runs the website germnurse.com. Hi, Erin. Welcome to the program.
Hi, Robert. Thank you.
All right. I'm so happy to have you on here. You're an infection preventionist, so you're down in the dirt with this organism and what happens in hospitals. So your expertise is invaluable. And let's go ahead and start with, what is C. diff or C. difficile?
Well, it's a bacteria. Clostridium difficile is a spore. So it essentially has a shell around it that makes it very hard to kill. And it causes colitis, an inflammation of the colon, and very severe diarrhea that can sometimes kill people.
Okay, and how does this bacterium cause disease? Is it normally found in the intestines? And
certain strains of it can be normally found in the intestines, and it's often a lot of us have it in our gut. But what tends to happen is that this is one of the byproducts of overuse of antibiotics. When we take antibiotics, a lot of the good bacteria that compete for resources in our gut get killed off also, and C. diff can take over and start dumping its toxins into our colon, and that's what causes C. diff disease.
Okay, and what are the most common symptoms of C. diff disease or C. diff infection?
C. diff infection is often going to have profuse watery diarrhea, a fever. It can have abdominal pain, nausea. In its more severe forms, it can also have blood or pus in the stool. If it progresses to more complicated infections, it can cause tissue changes in the colon that can be problematic and even cause the colon to perforate.
Okay. Now, we in the microbiology profession look at whether a microorganism is a colonizer or does it actually cause infection. So what is the difference between C. diff colonization versus C. diff infection?
Well, it's going to be like colonization with anything else. If a person is colonized with something, that just means that the germ lives, in them or on them and isn't causing them any symptoms. It isn't causing a problem. And we have all kinds of germs that colonize us. The problem with C. diff infection is when, that C. diff living in our gut, like I said, takes over, usually because we've received antibiotics.
Very good. Now, who's most at risk for C. diff infection?
Well, people who've received antibiotics are going to be the first group, but like with any disease, people with immunocompromising conditions, also with people with pre-existing problems with their gut, like ulcerative colitis or Crohn's, people who are getting chemotherapy for cancer are a risk group, and people over 65 seem to have more severe disease also.
Right, and this is one of the major reasons I wanted to discuss this topic, being here in West Central Florida.
Okay.
How is Clostridium difficile or C. diff spread?
It's spread like a lot of the intestinal organisms, what we call the fecal-oral route. So people, it's going to be excreted in the stool. It gets on people's hands. It travels on the infected person and caregiver's hands, and they can spread it to surfaces or to other people's hands. And a person ingests it.
Erin, you still there?
I am still
okay.
there.
All right, very good. Now, how common is C. diff? I mean, we hear about it in the news quite a bit now, and do we have some numbers on this?
The most recent numbers I had seen is that there's about 500,000 cases of infection a year in the United States alone. And it's killing almost 30,000 people a year in the United States. So it's becoming a lot more common.
Right. Yeah, it's really, really a big problem. And the CDC addresses this on a pretty frequent basis. Historically, C. diff infection has been linked to hospitals and other healthcare facilities as the primary place. Is this still the case? Are we seeing this also as a community infection?
Yeah, we're seeing it more and more in the community. That's, how we often divide diseases up into healthcare associated and community associated.
Right.
And this used to almost exclusively be something we saw in healthcare settings, but now about 30% of cases that we're seeing are acquired in the community.
Right. And I guess one of the big questions is, how is C. diff infection treated? Because this is a really difficult and devastating disease. Well,
a lot of people will resolve their C. diff if they're just taken off antibiotics. So the American College of Gastroenterology and the CDC, recommend discontinuing antibiotics, and if they're unnecessary, which the CDC thinks up to half of antibiotics we use in people may be unnecessary. So discontinuing those. If that doesn't work, then the College of Gastroenterology recommends Flagyl or metronidazole, which is a common antibiotic. And if that doesn't work, or they can't take, it's also called Flagyl. If they can't take Flagyl for some reason, then oral vancomycin. But that's causing its own problems, and we're seeing a lot more. They think that treating C. diff infections with vancomycin is helping fuel some of these other vancomycin-resistant bacteria.
Right.
So the preferential treatment, if you need to use an antibiotic to treat it, is Flagyl. And then there's also promising, it's also been promising to do fecal transplants, they're called, or FMT. And in that case, you take stool from a healthy donor that still has the healthy bacteria in it and get that into the person's gut. And that's been very promising. Like 90% of people, even with recurrent C. diff infection, respond to that after one treatment.
Very good. And the one of the reasons I really wanted to go over this is because a lot of people in the public find it odd that an infection that's caused by antibiotic use can be treated with antibiotics. Now, how can C. difficile infection be prevented? And this is right up your alley, in hospitals and other healthcare settings.
Well, I know I keep hammering away at this, but the first thing is more judicious use of antibiotics.
Sure.
The CDC thinks that we can probably do away with a third of the C. diff infections just by using antibiotics appropriately. But the other measures are going to be infection control measures. And in hospitals, when a patient has C. diff or is suspected of having C. diff, they're put in a special kind of contact isolation where they have, it's like contact isolation for other drug-resistant infections in that you wear, gloves and a gown. But with C. diff precautions, you also have to wash your hands with soap and water because hand sanitizers don't kill C. diff. So one of the main things that you can do is if you are a healthcare provider, if you're a physician, if you're environmental services, if you're dietary, if you're a visitor, or even if you're a patient, observe those isolation precautions in the hospital. Even if you just think you're going in the room for a minute. Go ahead and observe those. And also if a patient, especially if they have a history of C. diff, in case they're colonized, if they develop diarrhea while in the hospital, you can isolate them preemptively until you get, unless C. diff's been ruled out, assume that it might be C. diff and go ahead and isolate them instead of just doing a wait-and-see approach and spreading it around to other patients. And then things like, if it's possible, using equipment that's just for them. Dedicated equipment is what we would call that, using dedicated equipment for them or cleaning it really well afterward. Also, if either putting them in a private room or rooming them with other C. diff patients, if that's the only infection they have. Oftentimes in hospitals, we'll see that, you can have various patients with C. diff, but maybe one has MRSA also, and one has VRE also. So you can't just room all these patients together, unfortunately, because they may get other things from each other.
Sure.
But if possible, cohort them together, have dedicated caregivers, have dedicated equipment, and then the cleaning of C. diff, like I said, since it's a spore, it's different than, it isn't as easy to kill as some of the other things in hospitals. So environmental cleaning is very important. And also with special things, usually bleach, but there are other things that kill C. diff. And good hand washing with soap and water. Have before and after caring for patients is really important, and using gloves with patients.
Very good. That's a lot of excellent advice. Now, piggyback on something you said, what cleaning and disinfecting agents or techniques are required for like surfaces and different medical devices in the hospital room or go ahead, Erin.
Well, it has to be something that kills spores. And, sporicidal, the most cost-effective sporicidal things that people are usually going to use is a dilute solution of household bleach.
Right.
There are other products that are EPA rated to kill C. diff spores, and as long as they have that rating, they can be used. And some places, if they can afford it, will also use UV for that. We'll use ultraviolet for that. But most hospitals are going to be using bleach because it's the most cost-effective, because everything needs to be cleaned with it. Sure.
And like you said, it's very, very common, very, very cheap, which hospitals definitely need. Let me ask you, do you have any advice for a hospitalized patient? Is there something they should be on the lookout, like make sure their providers wear gloves or?
Gloves are good, but it's for patients, they should feel comfortable asking anyone to wash their hands with soap and water before they touch them. Mm-hmm. Even if a person is wearing gloves, wash your hands with soap and water and then put on gloves. It's hand hygiene is very important. It's if they're able to, washing their own hands with soap and water, especially before they eat, is a good idea. If they've touched anything in the hospital room, which, they probably have, especially if they're ambulatory. Of course, if they develop diarrhea, reporting it right away, right, especially if they're on antibiotics.
Now, this C. diff, I don't want to call it an epidemic, but it has been increasing over the years, has an economic cost too. So what is the cost in dollars and cents of C. diff in the U.S.?
The last figure I saw is that it's almost $5 billion a year. Wow. That it's costing the United States healthcare system. So it's significant. And I think, I think the CDC probably would call it an epidemic. They came out with a antibiotic threats in the United States report a couple of years ago that was very interesting, and there were only 3 agents that they called urgent, and C. diff was one of those.
Very good. Well, we got everything we need to know about C. diff in this short period of time. Thank you, Erin Archer Kelser, and please come back, ma'am.
You bet. Thank you, Robert. You have a good one.
All right, you